Good morning. This is going to be your first non-math lecture, and ordinarily I would be starting the rest of chapter 4 right after we were done with the last math pretest, but of course the situation being what it is, he'll only be there in pharmacology for 2 hours on Friday, and so it's up to you to listen to these lectures, follow along in your book, and follow along on the PowerPoint. So what I recommend that you do is to bring up the PowerPoint, which I will download to Edmodo. You want to bring up 2 screens. You want to follow along with the PowerPoint while you are listening to me talking on YouTube. And I will go from PowerPoint to PowerPoint so you can make sure you're in the right place if you have to check, but it's not the best. It shakes around. It's like watching the Blair Witch Project. So I recommend that you just follow along on your screen with the lecture in the background. I cannot stress the importance of listening to the lectures, following along on the PowerPoint, taking notes. It's not a bad idea to take notes in your book, because occasionally you will have open book tests, and you will always be able to use your book on at-home assignments. So if you see something that you want to particularly remember that you don't see in the book, you can just jot it down in the margins. Although I suppose if you want to sell your book back, that won't work. But make sure you're taking notes. So let's proceed with chapter 4. Now we've already had the math. Hopefully you've had a chance to look through your textbook and you see that there are learning outcomes at the beginning of each chapter. That should be what you should know by the time you're done with that chapter. There is a whole bunch of key terms. I would encourage you to study those. So chapter 4, let's skip all the math because we've already done that in class. And we're going to go to page 40. And of course, my pharmacology type picture, because this is the chapter on preparing and administering medications. And this is going to tell you just the bare bones, the basics that you will need to know about giving medications before we start sending you out into the clinical area to possibly be on a med cart or assist a preceptor in passing meds. So this chapter that you're going to need to finish are on pages 40 to 61. And similar information can be found in the ATI book. I will always include ATI pages because it's very important that you're not only reading the textbook, but that you're also reading the pages in the ATI book. I also would do the practice questions at the end of every ATI chapter. They give you the answers, and it would be a very, very good idea to do those in preparations for tests, quizzes, and us taking the ATI test, which hopefully we'll be able to do here at school. So my recommendation is you read your textbook, then you come and listen to the lectures. And I know your time is tight, that's nursing school. You'll be with me for 2 hours on Friday where you'll be tested. The rest of the time, you will be able to listen to lectures and read your textbook. And I cannot stress enough the importance of listening to lectures, because there might be some information in the lecture that is extra that is not in the textbook, but you might need to know anyway. So it's very, very important that you follow along on these lectures. I understand some people didn't do that last trimester. Some of my students didn't do it last trimester, and their grades were not the better for it. All right, so on page 40, we see just some general principles of administering medications. And this is something that's going to be true for the rest of your nursing career. You want to cut down on distractions. Believe me, that is easier said than done. Everything you do, you're going to want hand hygiene. It's always a good idea to try to have everything you need. Try to anticipate what you might need. There's nothing more frustrating than going into a patient's room, ready to give them all their meds or to do an assessment, and you go to give them their meds and their water pitcher's empty. Especially if they're an isolation patient, you have to dress up and dress down every single time you go in and out of their room. So like before I would go in to give a patient meds, I would always take in a glass of water just to be on the safe side. If they didn't need it, fine, but if they did, they had it to take those particular meds. We will stress constant identification of the patient using two determining factors, usually the bracelet if they have one, their name, their date of birth, if it's at a nursing facility, a picture. It's a good idea not to unwrap the drug until you're with the patient, because many times they will refuse it or they're unable to take it, and then you have this unlabeled drug. Always use aseptic technique. You don't always have to use sterile technique, but you do need to be clean. Always use universal precautions. We don't know anyone's disease status necessarily, and we shouldn't have to if we are protecting them and ourselves with gloves and in some cases masks, face protection, mucous membrane protection, and gowns. HIV is spread by which 4 body fluids? I'm not going to list them here. The book talks about it. You need to look them up because I guarantee you will see those again. Handling of needles and syringes. You have to know how to do that safely. And as always, documenting per your facility policy. This is not in the book, and it is a good idea to take notes on this. Just to review, there are a lot of different PO medications that can be given. Tablets, we see those, we take those all the time. They can be in a lot of different forms. They can have a special coating on it that many times will be labeled XR for extra release or sustained release, or extended release. And then we have enteric coated. An enteric coated capsule protects your stomach lining. It's designed to break down in alkaline surroundings rather than acid, and so it will stay solid until it passes into your small intestine, where it will break down then, and that protects the lining of the stomach. A lot of aspirin is enteric coated. Capsules, these are gelatin tablets. They are either kind of gel-like, filled with liquid, or sometimes they will be the kind of little capsules you can pull apart with powder inside. The little tiny smaller capsules are called spansules because they're designed to break down over a certain span of time, and you want to take these whole if you possibly can. Now there are going to be occasions where you have to open up the medication and put it in applesauce or pudding to give it to your particular patient. And that goes by facility protocol. You don't want to break or crush anything sustained release or enteric coated. You'll have to talk to the doctor to get a different prescription. Liquids, there are a lot of different kinds of liquids. There are suspensions, which is powder in a liquid. You have to make sure you shake this very well to make sure it's distributed. A lot of moms recognize this kind of medication because we go and we get an antibiotic prescription for our children, for instance, and it is powder that we have to dilute with water, and you just have to make sure it's shaken well. Emulsion is a medication dissolved in oil. A lot of iron products used to be given that way. Elixir is medication that's dissolved in alcohol. That used to be a really common thing. Now they try not to give alcohol to people just constantly. But a really easy to understand medication that works as an elixir is NyQuil. Alcohol has very tiny molecules. It rapidly is taken into the bloodstream, and if you mix a drug with alcohol, the rest of the medication goes in with it. Of course, you don't want to give that to children. Syrup. These are medications dissolved in a very sugary liquid. It might not be actual sugar, it might be a diabetic mixture with some other kind of sweetener, but it's important to remember if you have a diabetic, you need to look at the ingredients in any kind of cough syrup because it might be some form of sugar. If it ends in OSE, it's probably a sugar. So we have, regular sucrose, but there's also lactose, galactose, maltose, dextrose. Lots of things might not be good for diabetic patients. And then we have a newer form of medicine that you sometimes see. These are lozenges, little films that you take out of a little plastic package, or something called a troche. Those are similar to lozenges. They usually will dissolve a little bit faster. You put these on the mouth or on the tongue and they slowly dissolve.